I know everybody, if you're a breast man, you need to put that on hold.
Thank you so, so much for your time, your openness, sharing knowledge. Like, this is how we learn together.
Finding a way to work through that trauma to be able to come back together again, it needs to happen. We need to understand that it is a thing, and it
Yes.
may be the thing that is keeping the two of you from being able to connect again. There is a lot that goes on. There is a lot of change that happens to a body carrying a baby and then getting the baby out. So today, I really am excited to share with you and your audience, Chris, about what happens after birth, and especially when it comes to sex.
And hello, welcome to another episode of 40 Weeks for Men, a resource for men, by men, in order to help us dads be the best we can be in this crazy, crazy world. So, as you know, 40 Weeks for Men is all for families. So, I'm very excited about today, as you can probably tell. I've got another interesting topic that a wonderful person from all the way across the world is helping me think about today. And so, we're going to be thinking about our partner's pelvises in pregnancy. Very important. So we're starting this series now, thinking about the pelvis in pregnancy. So today we're going to be thinking specifically about sex after pregnancy. So I've got an awesome person to help me think through this today. What I'm going to do is allow her to introduce herself, and then, yeah, we'll start talking. That's okay. Go ahead.
Awesome. Yes. So I am Lynn Shulte. I am a pelvic health physical therapist. I live in outside of Boulder, Colorado. So I live in the state of Colorado. We've got beautiful mountains here. I'm a skier. I'm a hiker. I love the outdoors. I also love to play tennis. But my greatest joy is helping to support pregnant clients and postpartum clients. So the pregnant clients, helping them to prepare their body for a smoother birth, and then the postpartum client helping them to recover from the act of childbirth, whether it's a cesarean birth or a vaginal birth. There is a lot that goes on. There is a lot of change that happens to a body carrying a baby and then getting the baby out. So today, I really am excited to share with you and your audience, Chris, about what happens after birth, and especially when it comes to sex. Because I hear this from my mamas all the time. It's like, they just want to have sex and I don't want to. And I
Mm.
really hope that after our interview, after our time together on this podcast episode, that you as a man will have a much greater understanding of what is going on for your partner
Yeah,
and
that's what I
why
hope as well. Awesome.
they may not, why don't they want to have sex?
Yeah, yeah. See, as you know, and I've told you before, a lot of the people that listen to the podcast are young fathers, some are a bit older, but fathers in general usually. I'm thinking literally that question that you posed. Why does my partner want to have sex? Why not? So hopefully you and I can talk about this today and
Yeah,
really give some
yeah,
really good information and really infuse that to understand their partners more. And while we're all thinking about our partners' pelvis in pregnancy. So with that,
right.
all those P's, let's think about it together. So what's the first thing that you sort of want us to think about when it comes to sex after pregnancy, Lynn?
So I think we need to understand, bringing it way back, that we are mammals. We are
Yeah.
animalistic, right? And really, sex is for reproduction. Like that is the whole, like in the animal kingdom, animals have sex in order to reproduce.
Yeah.
And when a woman has just had a baby, her whole energy, efforts, and physiology is to try to keep that baby alive. So
Yeah.
it's feeding the baby, it's caring for the baby, tending to the baby, it's trying to make sure that that baby stays alive. It
Yeah.
is not focused on reproduction again. And
Yeah.
so the desire for a woman to even want to have sex after a baby is just not there from a
Mm,
biological standpoint.
mm,
The body has just produced its whole focus is on like, how can I keep this baby alive? It is not ready to reproduce again. So from a biological standpoint, a woman has zero interest in
mm.
wanting to reproduce. Now, the other thing that you all need to understand is that caring for a newborn baby from a woman's perspective is completely draining. It is, if your partner is choosing to breastfeed, having a child breastfeed, it can take up to an hour to breastfeed a baby, and that's happening every other hour.
Quite a
So
while.
you right? And so to have someone sucking at your nipple for 10 hours a day, the last place a woman wants you to touch is her breasts.
Yeah, good point.
Okay, so I know everybody, if you're a breast man, you need to put that on hold. Right? Do
Yeah,
you know what I mean? Do you
yeah,
know what I mean? Like, if that's your area where you love to touch your wife or your partner, you're gonna have to put that on hold because they're sore. They're being overused. And there's like stimulating the nipples is not high on a woman's priority list when it comes to sexual experience when you're taking care of a newborn
you
baby.
are giving us some real good inside looks. Because really, this is like something that I know a lot of men struggle with, and we don't want to talk about these things because it's embarrassing
Right.
all the time. But this
Yeah.
is good understanding, good insight for us. But I want to ask you a bit further, because like let's be like I'm just playing devil's advocate here. But of course,
Yeah.
that sex, yeah, it's for reproduction, but a lot of people tell me that it's quite fun. People actually enjoy it. So why
Oh,
is it that,
absolutely.
yeah, yeah, why is it
Well,
that
and
yeah, people don't want to have sex more, like maybe straight away or a couple of weeks after they've given birth?
um because they just pushed if they had a vaginal birth, they just pushed a watermelon out of that space.
Yeah, yeah,
So now let's think about mechanically what has just happened. And thank God that men are now present at births these days. Because when
yeah,
I was born back in the 60s, men weren't even allowed in the delivery room. You get to see what happens and what goes on. And please um let's not miss this idea that childbirth can be traumatic
yeah,
for a person, and it can also be very traumatic for a partner to witness their partner being traumatized by this birth and this act of birth. And there's nothing more helpless than a man watching someone they love be in pain and
mm,
not be able to do something about it.
yes,
So
very,
so one of the things that I think is very unspoken is that there's a lot of trauma that happens in childbirth, and secondary trauma by witnessing trauma is a thing.
mm,
And so I've heard from, some men it's like they don't even want to touch their partner because of that trauma response in their body. And
yes,
so we need to talk the spectrum here because there are, and what I'm sharing is general. There are going to be outliers. There are going to be women who are going to be so hot and so turned on by having a baby and caring for a baby and want to have sex right away.
yeah,
But on the other side of the spectrum are those women that have been traumatized
the
by
majority,
their birth,
yeah, the
and
majority,
and even the partner may be traumatized,
mm,
and finding a way to work through that trauma to be able to come back together again, it needs to happen. We need to understand that it is a thing, and it
yes,
may be the thing that is keeping the two of you from being able to connect again.
yes. So you brought some real voice to the fact that this is a thing, and I appreciate you for that. But I do want to find out because I've got you here. So I'm going to find out what
Yes.
do we need to do as men, as dads, to change the rhetoric, to change this idea that after childbirth, the majority of women are going to be maybe traumatized, in pain, not really want to have sex, and not want their breasts to be touched. So what do we do?
Yeah. So one of the things that men need to understand is that women are giving, giving, giving all day long. They are all their effort and energy is to try to figure out this baby, to feed it, to keep it alive, right? And they are outpouring all of their effort and energies towards this living being to keep it alive. And if you have other children, then they're taking care of other children. And depending on your relationship, your partner may be trying to take care of you too.
Mm,
And so it's just a ton of outputting.
yeah,
And there's so much to do in caring for newborn children that the idea of sex is just one more thing on their to-do list.
yes.
Okay. But we
Mm,
can do something about this, men, right? Because what I would love for you all to try with your partner, and this isn't going to work for everybody, but one of the biggest issues that I see in my clinic with the women that I work with is their inability to receive support.
yes.
Their inability to receive support. And usually that comes from you. Like you guys are trying to help them, right? You want to help them out, but they're denying you every step of the way because they lack the ability to receive support. And so if you can find a way to, number one, call them out on it and say, honey, let me support you. Let me help you out. Find ways to offer support to your partner throughout the day. Because when it comes to sex, guys, it's not about what just happens when you think, I want to have sex with my partner. Boom, let me have sex with my partner. If you want to have sex with your partner, the foreplay comes all day long.
Yes. This is
The
good advice. I'm
foreplay needs
laughing.
to
This is really
happen.
good advice.
The foreplay needs to happen all day long and not just when you want it. And the foreplay needs to be your input into them, you helping them by maybe and there needs to be like I would say immediately after, like in those first 6 weeks when the doctors are like you can't have sex, right? You can't have the physical penetrative sex, but you can offer a supportive touch. You
Yes.
can just put your hands on your partner's shoulders and maybe just gently rub them. You could rub her feet. You could, massage, just, massaging, giving her head a scalp a rub. Like all that is inputting into her system. Because what women need to understand is that having sex with you shouldn't be something that they have to do. Maybe it should be something that they just get to receive.
Mm,
So for you guys, I want you, especially when there's a newborn baby, that baby is less than a year old, I want you to think about sex being something that you can offer your partner and not something that your partner has to do. Does that make sense, Chris?
I'm making some real good notes here because, like, even me, I'm like, oh my gosh, honey, I
Yeah.
need to support you. How do I do this better? My goodness, really great stuff. Really great stuff. So I'm sure people are gonna have to play, pause, rewind, do whatever they need to do to get the nuggets of gold in this conversation. But I want to ask you, Lynn. So I think you're aware, and obviously you see it from a different perspective because you've got ladies in your clinic that have pelvic pain and struggle after birth. But I want
Yes.
to find out Obviously, I'm trying to bring voice to what dad's perspective on having a newborn, and we're talking about
Yeah.
sex today. But I want to find out, what do you think are some of the worries that dads hold when it comes to thinking about having sex with a partner again?
Right. And so let's first clarify this idea of sex, okay?
Yeah,
Because sex, mostly, most people, when they think about sex, it's penetrative sex,
yeah,
right? It's
yeah,
penis entering vagina and, orgasm being the end goal, right? For both
yes,
partners.
yes,
And let's bring that back a little bit and let's understand that sex doesn't have to involve penetrative sex. It doesn't have to involve penetration, right? You both can achieve orgasm without penis in the vagina.
that's true.
Okay. Right. So while we're talking that first 6 weeks, a woman's not allowed to have sex because she's still bleeding and things are healing.
Yeah,
So there is a way, men can still give a woman an orgasm, and this could be a beautiful way for you both to explore what can cause an orgasm in your partner. Okay. And this is not a time for a man to be asking for a blowjob or a hand job, or, a woman having to give you that release yourself. Okay.
yeah,
Because remember, I talked about how tapped out they are,
yeah.
how
Giving,
how
giving,
much they
giving. Lord.
giving. Yes,
Yeah,
yes, right. So
yeah,
so this is where I really want a man to understand that he needs to be inputting into a woman and not asking of the woman
yeah,
during this time. Okay, because they don't have much to give.
yeah,
And I want you all to think of this as like a woman is your bank, and every time you touch her, you're making a deposit. Every time you do something for her, you're making a deposit into her reserves, which is her bank. And so, if you can, and ask your partner, what would be helpful? What would be supportive for you while we're raising this baby together? And giving her time alone so she could go take a bath or go read a book or go for a walk, like those things. And like, I've got the baby, honey, you go check out. That's putting a deposit into the bank so that mom has more reserve in order to give to you when it comes to sex. Okay. So I
right.
want you all, like, I think, and this may be a general viewpoint, but I think most men think of sex is the act of penis and vagina.
Yeah,
And there's so much more to it than that. And that's where we need to expand our horizons when it comes to sex in the postpartum period. Okay?
a good point.
So okay, so find ways to deposit, make a deposit into your wife, but you need to figure out what that is, because you may be doing, and figure out what her love language is, guys.
What a shit.
Love language is a whole
Yeah.
book. Because if your love language is touch and hers is maybe gifts or acts of service, and
Mm.
you just come in and you're touching her, touching her, touching her, remember I just told you she's touched
What are
out,
you doing?
right?
Yeah, what are you doing? Yeah, yeah,
Yeah, you're pushing her away. But if
yeah.
her love language is acts of service and you are bringing her water, guys, when women are breastfeeding, they instantaneously get massively thirsty. And
Mm.
if they do not have a glass of water nearby while they're breastfeeding, just make that something. That's your job. Every time they breastfeed, you bring her water. That is an act of service. So finding out what your partner's love language is and doing those things will help make a deposit into her bank, which will give her more reserve, which will make her a little bit more open to this idea of sex. So I just want men to really get this understanding. Women are touched out, they are depleted, they are giving, giving, giving. And the first 6 weeks to first couple of months, they're still healing. And you need to be giving. Like, and help your person to receive. help them to receive your giving. Okay. That's the first step. Now, the other thing that I want men to understand is that when a baby comes out vaginally,
Mm.
and if you're watch the video here, I have a pelvis. This is a
The
pelvis.
pelvis
The
there.
bone of the
Let me have a look at
this
that
is a little
pelvis.
can you see how tiny? Isn't this
Can
cool?
see that
And it
pelvis.
moves.
Go and carry on.
Yeah. Okay, so the pelvic bones, in order for a baby to come into the pelvis, the bones actually, this is called the pelvic inlet right here, and the
Yes.
bones need to widen to make the pelvic inlet open so baby's head can come in.
Right.
Then once the baby's head comes in, then the pelvis needs to go the opposite direction. So the sit bones that you're sitting on right now, they
Yes.
need to splay out to the side, and your tailbone needs to move backwards in order to widen the pelvic outlet for a baby to come on out.
Right.
Okay. And so, and this is something that I have discovered in my practice that not many other practitioners are talking about. But I'm coining this the open birthing pattern in the pelvis because some women's bones don't always go back to
Mm.
their original position after birth.
Right.
Okay. Trauma is one of the biggest things that causes this to stay open like that.
Mm.
Also, a way a baby comes through, if a baby comes through sunny side up or occiput
Mm.
a posterior, OP is what they call that.
Mm-hmm.
Those are all ways that a larger part of the baby's head has come through that pelvis, and it's a much more challenging birth to a person when that
Mm.
happens. And the bones of the pelvis have to open up and even wider. And so then the bones of the pelvis might be a little bit wider. The pelvic floor muscles that attach, you see where my hands are here, they
Yes.
attach from the tailbone to the front. Okay. Now, if those bones are wider, those pelvic floor muscles are on stretch.
Stretched. Yeah.
They're stretched open. And so there's tension on them. And
Mm.
then the vaginal opening where you want to insert your penis is actually on stretch, and those muscles don't have the ability to open wider. So that could be a cause why you might have pain with
Pain.
penetration.
Mm.
Okay. And then also if your partner tore it all and they had to be stitched up, or the doctor did an episiotomy where they actually cut the tissues, that has to be stitched up. So you have to wait for all that to heal in order for you to have penetrative sex. However, scar tissue is created in that healing, and scar tissue is not as flexible as normal tissue.
No tissue. Right.
So scar tissue can cause it doesn't allow the tissues to expand to allow the penis to insert,
Mm.
and that can create pain. Okay.
Right.
So what can help is there is an exercise that I will send to Chris, and we'll put it in the show notes. There is a YouTube video on how to close the bones up after birth. It
Mm.
requires you to put your fist between your partner's legs, and she squeezes your fists together using her leg muscles to
Right.
help bring these bones back together. There's
Mm.
6 different things you need to do. It's all covered in the video.
Right.
Watch that and do that with your partner. It doesn't matter how long ago the birth has been. If you and your partner are having problems with insertional pain, the bones being in this open position might be one of the causes of
One of
that
the reasons.
pain. So
Mm.
try doing that. Do it every day for a week and just see if it changes anything. Okay.
This is really good, Lynn.
Then,
Go on.
then we've got to work with the scar tissue too.
Yes.
Okay. And so have your partner, let your partner know that she can, and I encourage her to do it herself because then she'll know her pain level. But she just puts her thumb in vaginally and her finger outside wherever there's scar tissue, and you
Yeah.
just kind of rub that scar tissue, and you try to like pull on it a little bit
Okay.
to
Not
help
easy.
soften it.
Okay.
Okay. So that the scar tissue needs compression, it needs to stretch a little bit to be able to open so that you can insert without pain.
Mm.
Okay. Now, if there's been trauma, that trauma may cause a freeze response in the body. So a trauma is if the doctor heard if you heard the doctor say if you don't get this baby out in the next push, you're going to need a C-section.
Yes.
Okay, that can cause the body to go. Okay.
Yeah.
That's a trauma response in the body. It's a freeze response.
Mm.
And in childbirth, you can't fight. So our trauma responses in the body are fight, flight, or freeze. Well, in childbirth, you can't fight it and you can't flight from it. So freeze is the only option. So those
Yeah.
tissues, it's like the pelvis is holding its breath and it
Yes.
hasn't exhaled then. Okay. So we need to work with that trauma response. We need to help get healing to the body. And that's more than, you can try to help your partner just connect in, but a lot of times the trauma causes them to disconnect from their pelvic space because it was too much.
Yeah.
And
Good.
so they have a hard time coming back down to that pelvic space.
Good point.
And so if doing the scar tissue is really painful or it's not changing, those are signs that they need more support. So there are pelvic health physical therapists out there. Help
Yeah.
your partner find someone who has done that. I train practitioners. I have a directory on my website. We'll put it in the show notes.
Yeah.
You can see if there are people in your area that might know how to help support your healing. Trauma is something that can be worked over Zoom. So I see clients, I'm at the Center for Birth Healing. You can check out my website and, do a Zoom
What is your
session. We can
website?
work with
What
the
is your
trauma.
website? What is your
So
website?
yeah, centerforbirthhealing.com.
Okay, and we'll
So,
also
and
put it in the description as well so that people can go to
yeah,
that as well.
and just so you know, it's not spelled like you guys do in England. It's
As long
ER,
as how
not
we
RE
spell
at
it.
the we so do you see it's on my shirt here? You guys
Oh,
don't
I
you
see
spell it
it.
RE?
Yeah.
You guys spell it RE. I spell it over here we spell it
ER.
ER.
Yeah. I mean, I'll give it to you for now. Out of position
Okay.
of love and peace, I'll let you have that.
Yeah.
Yeah.
Well, so we've talked about insertional pain, Chris.
You
I
have.
want people to know that there's also deep thrusting pain
Tell us
issues.
about deep thrusting pain.
So deep thrusting pain is the cervix, which should be in the middle of the vagina,
Yeah.
needs to be able, ideally needs to be able to be like a piñata inside that vagina, meaning it can move out of the way and it should be able to move up and down with the thrusting.
Yes.
If if a person has had a cesarean birth,
Mm.
there is scar tissue that is keeping the uterus from being able to lift up and away. So
All
the
right.
cervix is anchored. It's anchored in the midline. And so the penis is just hitting it and it can't move and
Right.
it needs to be moved out of the way. And it can't because of the scar tissue from the C-section scar. So I
Mm.
have another video on YouTube on how to massage your C-section scar. We'll put it in the show notes, okay? That
Definitely.
you guys can check that out. And having your partner massage her C-section scar, you could get in there and try to help out. Just don't create pain, okay? Respect the tissues, but we need to try to get mobility and especially that lifting mobility of those tissues so that the uterus, the cervix can get out of the way.
Yes.
After birth, the cervix, I find it everywhere in there vaginally. And it's not always in the midline. It may be tucked off to one side. And
Mm.
so if you are having pain with intercourse and you're trying it, you might want to try a different angle and
Yeah.
see if a different angle might help. So you might want to try aiming towards the left as you're thrusting and see if that's better. You might try aiming towards the right and
Yeah.
seeing if that helps. You may want to try aiming anteriorly towards her pubic bone, or you may want to try to aim posteriorly. And all that can be adjusted by your position.
Good point.
Okay.
Point.
So those are things that, if the cervix is stuck and you're getting that, like you're thrusting in and your partner's going, ow, try changing your angle and seeing if that helps. If
Mm.
it's stuck right in the midline and there's no way for you to avoid it, then they just need to go get some support And
Yeah.
seeing someone who knows how to manipulate and release the cervix intravaginally is really, really helpful.
That's really good advice. Really good advice. So there are so many things there, food for thought. But I want to ask you, Lynn, just as we close now, let's think about the dads that listen to this podcast. So,
Yeah,
as we've sort of spoken about, there are lots of issues here that bring lots of worry. And a lot of time you will feel quite out of your depth. Like, oh, what do I do
yeah,
here? My wife is not feeling, or my partner's not feeling it. What do I do? And it's quite scary. And I think you've
yeah.
alluded to it slightly, but I want to find out from you, how do you think dads or partners can find encouragement in this area of having sex with their partners after pregnancy?
It really needs to come down to open communication between you and your partner.
Yes.
If you're shy about talking about sex, you got to get over it.
Yeah.
And if your partner is shy about talking about sex, you're gonna have to figure out a way to, like, maybe you write about it. Maybe instead, if your partner's too shy to talk about sex, have them write down what they like, and you each write down what you like from each other,
Yeah.
and then you share your lists with each other, right? Like, there are ways around that shyness,
Mm.
but if you really and you really want to pleasure your partner and you want your partner to pleasure you, we can't read minds. We've
Yes. True.
got to be able to talk about this.
Mm.
And moms have got to be able to talk about how depleted they are and how worn out they are. And partners need to understand that intimacy is there's other ways for us to gather intimacy, and women tend to like those other ways of gathering intimacy with their partner other than just penetrative sex.
Yep.
And
Yep.
there is a great website out there that I want to plug, and I have no
Yes.
affiliation with this website, but it is
Sounds good.
called O the letters OMG
Yes. Yes.
yes.com.
Okay.
Okay. Put
OMGYES.com.
.com. It
Yes.
is a fabulous website, and it's to help women to explore their own bodies, to figure out what pleasures them.
Mm.
And then there are partnered videos to watch, and it's done so beautifully, Chris, so beautifully that it's just so professionally done.
Helpful.
And if your partner can explore it, use it and explore what works well for her, and then she could share her password with you, and you go watch it, or you watch it together and you explore together, it's a beautiful way for you both to find out what works best for you. Because another super important fact that men need to understand in the
Yes.
postpartum period is that it can take a woman up to 45 minutes to get aroused.
Really, it's quite a while.
That is quite a while. So their
Yeah.
ability to turn on is not as quick as it used to be.
Yeah.
And so that's why I'm talking about, like, and when you're working with a baby, it's like you don't have the time. I mean, when you're dealing with a newborn baby and you're so tired and exhausted, you don't have the time. 45 minutes is a long time to get your partner to where they actually can have penetrative sex,
Mm.
because there's so much going on hormonally for a woman that is causing her to be drier, and it's harder for her to get lubricated.
Lubricated.
So you
Yeah.
guys really need to use a lot of lubrication in the postpartum period. So if your partner's really dry and they're not able to get as lubricated, it's a hormonal shift from
Mm.
being pregnant.
Yeah.
And you may notice that your partner was really juicy while they were pregnant, but that drastically shifts and changes once a
Yeah.
baby comes on out. And
Yeah.
now they're drier. And so you've got to use more lubrication and take it slower and find more ways for foreplay.
Yes.
Find more ways for foreplay.
Ways for foreplay. I really love that. That's great. So, Lynn,
Yeah.
you and I can speak about this forever. let's just think now,
Right.
as we close now, is there anything else that you want to say to the people that are listening?
Yeah. Oh, men, find ways that you can help your partner, help support your partner. And one of the things and the other thing that you need to understand is that when caring for a baby, your wife is going to be very meticulous about how she does things, and she's going to want you to do it her way, but help her understand that there's daddy ways, that there
Yeah,
are ways that daddies do things and there's ways that mommies do things. And babies are okay, babies are adaptable. And so you creating and you having your own relationship with that baby and you spending time with that baby to give your partner a break is going to make lots of deposits into her bank account to help fill her up. So I would encourage dads to find times to take the baby from mom and give mom her own time alone.
that's
That
very
is
good.
what's going to help everybody out in this situation. So I recommend to my mamas is like have dad do bedtime. Like as your baby gets bigger and or have mom breastfeed and then give the baby to dad to have dad put baby down for bed. And then as kids grow up, daddy does bedtime. So self-care is like and women have a hard time taking care of themselves because they want to take care of everybody else.
Yep.
And so you just need to keep reminding them, keep reminding your partner, like, no, this is your time. Go do something fun for you.
Mm,
I've got the kids now. You go do something for you. Because if they are a full-time mom or stay-at-home mom, they don't get a break.
very good.
They need a break. That I've mentioned is going to help improve your sex life if you can communicate,
Yes.
but you're giving your wife the support, your partner the support that they need in order to take care of themselves, in order to want to have sex again with you.
Yes, this is good stuff. Wow. So, Lynn, this really good stuff. I'm sure even me myself, I'm gonna go back to the drawing boards and actually do some real good thinking and talking to my wife myself. But yeah,
Great.
thank you so much for your time, your openness, sharing knowledge. Like this is how we learn together.